Hello, Nicole Argentieri.
Hello.
How do you say your last name?
Argentieri in the
Argentieri.
more English way, but Argentieri in the Spanish way.
Argentieri. Oh, yeah, that's right. You have like an
Yeah.
Argentinian background, don't you? Or
Yes. Well, the name is actually like Italian, but my dad has been there. He's like third generation Argentinian. So
cool. Yeah, that's cool. Yeah, because there
yeah.
was a mass immigration of Italians to Argentina, Brazil. I have family in Brazil.
Yes.
So welcome, Nicole. So you are an RMT.
Yes, I am.
But a special kind. So you work, well, correct me if I'm wrong, but like you work with the fascia of the body as a primary focus.
Yes.
Tell me about that. What
Well,
is the
there's a few things that I do with the body. So like I'm an RMT, but under my scope of practice, I also do fascial stretch therapy and Reiki, and I love combining them. So I'm really quite obsessed with working with the fascia, but then also the lymphatic system, because without acknowledging or treating the fluid systems, the fascia just kind of like is sticky, tight, like restrictive, affecting your mobility, could like be a part of like chronic pain syndromes like fibromyalgia, myofascial pain syndrome. So using the lymphatic system, stimulating it, and then addressing the fascia, I think is just like amazing for all those conditions and so many more conditions, your breath, all of that. So like I combine my knowledge with massage therapy, like general Swedish techniques with fascia and stretching. And sometimes my clients really like the energy work component because there's a lot of stored tension, like emotional tension, spiritual tension in the fascia. Like the soul's in the fascia is what I was taught, and I truly believed that. And so when emotions come up, which they do every single time I stretch somebody, for the most part, the energy work really helps consolidate the treatment or like integrate it and make it this like really great experience where you can become or feel embodied.
That's so cool. Yeah. I have the experience of having a massage from you. We were at our friend's cottage and we were just kind of messing around. You were practicing and you have this gift of being able to find the spot, which maybe, and we'll probably dive into this a bit more, is maybe the secret of fascia, because fascia, it's like the saran wrap of the body. We've talked about this on my podcast before. So like around our muscles, we have these kind of like clear, looks like saran wrap kind of tissue that, well, maybe tell us about it, because you obviously know more than me. Like, what is fascia? Why does it exist?
Yeah, absolutely. It's actually been around for ages. Like the term, or sorry, the fascia is a newer term, but like we've just been considering connective tissue for a long time. But now it's becoming more acknowledged in like anatomy, right? But it's the scaffolding of our body, and it's not just superficial. It's in between everything. Like it's in between our joints, our organs, our skin, our muscle tissues, even within the muscle fibers. Like if you peel back, like if you cut meat or something, or like if you cut the skin between like muscle, with like, you cutting any kind of meat, you see all these little like sticky like fibers in between. And so like that's fascia, like it's like in between everything. And the like quality of your fascia, like if it's really healthy, it's way more fluid and it slides better, right? But if you're dehydrated or sick or just immobile, it becomes way more stiff, right? So it contributes to like like injuries and feeling tight, or like so that is really incredible that the fascia just does all this stuff. And like I'd like to use this information to, or share this information to clients in the most like layman's terms, where you can imagine an orange, right? So like, the white part of the orange where it kind of holds all the pulp together.
Mm-hmm.
Yeah. So that's kind of like how you can visualize fascia. Like it holds everything.
Mm-hmm. Yeah, it's like, so yeah, we like rip that stuff apart to get to the juices, but ultimately without it, you don't have an orange. Like when you're drawing an orange, a picture of an orange, you're drawing the fascial connections basically, right? The kind of crescent moon shape with the little, the lines that go through it that hold all the little sacs. And even those sacs are probably held together with fascia. And so like when I learned anatomy in undergrad, I remember thinking like, okay, we're learning about all these things, like our muscles, our joints, our organs. How does it stick together? Like we never really articulated that in anatomy, right? And so that's the fascia. It's like literally the glue if you're building a human body that
it completely. And it's really sad because the main parts of the body that I like treat or like focus on are things that like my school program or like most like generic school programs for bodywork or anatomy, they just kind of like glare over it. Like they just kind of like have a couple classes on it. I'm like, this is the main information that we need, and we need more than 1 or 2 classes to cover fascia, to cover lymphatics. They're everything, right? Because it's their integrity that responds to the muscles, the tension that people come in with, right? So, you know, like I was saying, like when there's like low integrity with fascia, you know, you find things like trigger points or like injury, scar tissue, all of that, right? So that's why I love treating it, and it has this amazing feeling of relief after you address it. And I find that, you know, so many of my clients, they try all these therapies, massage therapies, and they don't address the fascia or the lymphatics. But when they see me, they're just like, oh, well, now this actually really helps me. Like I've tried other things, but this actually makes a huge difference. And I believe in treating it. So yeah.
And yeah, like so where I was getting at when I was talking about, you know, when we were playing around, you were giving me a massage, and it's almost like an adjustment. It's like a massage, but there's this like this like active release type stretching thing that you do. And the thing with fascia, maybe people can visualize this, is if you wrap a piece of meat in saran wrap and then you stick your finger in a point and twist, you'll see the saran wrap, like the whole thing will get tighter in certain areas. It'll affect all of the meat. And that's sort of this idea of like there are specific pressure points, but maybe the whole fascia itself, when you get to know it, like if you're skilled in understanding and reading fascia and like feeling how somebody's body feels, you can sort of, it seemed like you knew intuitively with your fingers like where the point was of tension that was creating all this other tension in my body. And that's why it felt like wizardry. It felt like, oh my gosh, I can breathe better. Like, and it was sort of
witch.
Yeah, exactly. I was like, how did you? Yeah, I'm like, I can breathe. It was, this like crazy, like, so it's like this unraveling of this tension that gets formed as we move. And like you said, dehydration, the trauma connection is super interesting, which we talk about, like, there's like, it's like a network, and I've heard it equated with the mycelial network of mushrooms, which is why one of the one of the things that we prescribe for trauma, it's a little bit more like of an energetic medicine type thing, but reishi mushroom is thought to work energetically because how it works in nature is its mycelial networks break down dead wood. So it grows in maybe like a birch log or a dead log. And part of what it does is metabolize that wood to become soil and to become something new ultimately. And that's the idea, is maybe there's a similarity in how it might work in the body. When we take reishi internally, something about it, whether it's energy, gets into our fascial adhesions or our fascial layers and pulls out this stored trauma that we might have accumulated in our body over, as a relation, like as a material expression of our experiences in life. Which is super crazy. But you also you notice that when you start to work with the fascia and maybe even come across those points, things start to open up for people.
Oh yeah, it's wild. Like, and so I'll palpate, which means I put my hands on someone, start poking around, and I'll feel, and like in your case, if you're okay with me talking about our experience together, was that you were having issues breathing. You had this like mid back pain, like somewhere in your mid erectors to lower back, but you were having trouble breathing. So I did like lower back stretches and massage, and then like your abdomen as well. So like the biggest thing was the abdomen, because you had like a trigger point in your diaphragm.
Yeah.
So but I also noticed all your organs were just like compressed and they were like stuck. So as I pushed around, I was like, okay, like the main thing that I like to do with people in any case when there's stiffness is to mobilize the area, like just to kind of like kind of like open things up in such a way that if there's like compression, the organs can separate. Like they cannot feel like they're condensed or like stuck. Like, you know, you have a sausage casing. That's kind of sometimes how our organs feel with our fascia, but we kind of want the surrounding to be like fluid and move around so that we can breathe and move. And when it's too tight, we're like, oh, it hurts. And it's sometimes organs, sometimes it's like your fascial integrity, right?
Mm.
So, and that's the balance of your fascia, right? How like your body weight and gravity affects your whole like kinetic chain, right?
Mm-hmm.
Regarding fascia. So I was figuring out like, oh, like let me just like her ribs are stuck too. So let me just like with the breath, and most importantly, all the work that I do is like cued with breath work to bring that breath into the area that I'm treating. And so you open it up, you oxygenate it, and you move it. You're bringing new nutrition yourself as well. So it's collaborative, right?
Mm-hmm.
So you're breathing into those areas. You felt the pain. We worked through it. I would go deeper, move things around, and then it released. And then you were able to do your yoga without that pain. So that was amazing.
Yeah. And it did feel very collaborative. Like it felt like we were participating. Like you gave me instructions. It was like a yoga class, but someone has their hands on you and is feeling into what's going on. It like really helped with this body awareness piece of, oh, okay, like I see, yeah, I know what you mean, because when you press here, I feel this. And you knew that too. It was really crazy. It was very empathetic in that sense, that you could feel into what I was feeling.
Yeah, it was really powerful, right? And so like when I, you know, I'm different than other practitioners in a way where a lot of it is very much education, but in a way that is empowering to the person, to the individual that I'm working with, right? So like the embodiment process is like also you learning about your body, and why like a lot of these techniques or treatments from me are like sustainable for a lot of my clients is that they start to learn what areas they have of stagnation, because they're like, I had no idea that I felt that way, or that there was an issue there, or that I was feeling this emotion and it feels connected to that. And so like when that comes to their awareness, rather than just like quiet treatment, I do the work. They have no idea necessarily what's going on. Some people do, but like some people just don't know. And like to build that connection, it's kind of a conversation of like bringing both the people into awareness to acknowledge these areas. And once it is like, once you do become aware of it, it brings life to it.
Yeah, totally.
And so you bring energy into it. You bring life and energy into it, nutrition, blood flow, emotional awareness, mental awareness. So it's really great in that sense.
Yeah, you're bringing blood and we're participating. It's your own body. Like one of the things I see a chiropractor and who I really like, but one of the things, and I think it's that particular modality or that type of medicine or the structure, the business structure, a lot of chiropractors follow. It's like you go in for an adjustment, not a lot of time, not a lot of communication about what's happening, although he's very nice. It's not like, oh, I'm noticing this connection. I don't really get an anatomical description. And then there's sort of like a separate, and this is my experience with physio as well, there's a separate prescription of certain exercises to do. But after after body work with you, you don't need to prescribe me like, oh, make sure that you breathe like this. There's an experience that you have that lends itself to action later on, because you have this experience of your body changing, of accessing something in your body, and you can feel the difference in your breath, and you have this reference point now. It's like, oh, this is what it feels like to properly breathe. When it starts to tighten up again, now I kind of know, and maybe I can get back into that position and I can breathe in that way and see and notice if that spot loosens. Like there's this map that you receive from the experience, which is so cool.
Yeah. And I think that is my one problem with a lot of these other therapies, and not to say that they're all bad or anything like that. It's just like my experiences and a lot of my clients' experiences with like physiotherapy, chiropractic care, it's very, ironically enough, disjointed. Like so many people, the majority of people will come to me or other therapists like dissociated from their bodies at a certain extent, right? Like they're they're on their phone all the time. They're not in their bodies. And like your job as a healer or body worker practitioner is to facilitate that connection, right? And so there's not a lot of really good communication regarding that, or like empathy or intuition regarding that. It's like people are just regurgitating what they were taught in school without having a sense of who they are in that practice and how they can truly help the other person. It's just very disconnected. And so like, again, like all my clients are just like, they told me to do these exercise, or I didn't feel like it helped. And it's they weren't learning, they weren't feeling the treatment or session or experience land in their bodies. They weren't met where they were. And so what I try to achieve with my clients is to meet them where they're at, so that when I do offer a treatment plan or this map of healing, they know exactly where I'm coming from, with a deep awareness and sense of empowerment to pursue that. You know, like they experienced that in the session. They felt enlightened, or like really deeply aware of what they felt and happened. And they want to continue that because they felt like, oh, like I can learn more. But it's not just learning, it's not in the mental. It's like I felt it in my body. So when you connect mind, body, spirit in that way, it becomes way more clearer to the individual that they can actually sustain this work, you know, versus feeling disempowered and like, I don't know why they're offering me this. I don't know why they're telling me to do this, you know. And even, you know, a lot of a lot of these other practitioners or therapies, they're not like they're recommending exercises for someone who has deep trauma in that area, and they just will not do it, you know. So kind of unpacking that, you know, client history and like the personality, all of that. And you know, I'm still learning as I go, because I'm pretty fresh to this industry last few years. But yeah, that's what I like to approach it with, in contrast to those therapies.
Yeah, it's more like you're like the experiential piece. And like I love what you said about this disembodied. People come in a disembodied state, right? Like our bodies are this like kind of pole that we carry our heads around on. This is what we one of my professors said. And you know, and that's so, and it's almost, I think it's even worse now than when I was in school, where now we have smartphones. Like smartphones weren't such a big thing back in like 2012 type era, you know? And
they weren't so smart.
They weren't as smart. And like the cameras, I feel like the camera was this evolution, because not only are we disembodied, but we're like image, it's we live in images now of ourselves. Like we've projected like images, like even this podcast, right? So my voice lives, our voices live now in this kind of infinite space. This recording lives on forever, these images of ourselves. And we lose this contact with what it's like to actually be sitting here and experiencing this moment now. And I've had the experience over and over again that when I'm in touch with my body, which usually requires removing a lot of stuff in my environment and having a lot of space and time, getting into more of a meditative state or doing body work practices, that it becomes like intuitively clear what to do about your neck pain, about your back pain. It's like, oh, you know, I can feel the connections here. If you don't have the anatomical like education, it can be a little bit trickier, but this is also part of where you start to develop the experience, right? It's like when people are doing trial and error with nutrition and they're like really feeling into what feels good, what foods do I like, what foods feel good in my body, right? It's like this process that is annoying because it'd be really nice if someone can just give you something to do and it will work, but it doesn't really work like that, right? Like part of what healing is us tapping back into our, like living back inside of our bodies, moving back home into our bodies from wherever we're living, you know. And then you know, and then like going on the topic of trauma as well, sometimes our bodies are not a comfortable place to live in. We experience pain in our bodies. That's where trauma, that's why a lot of psychotherapy now has moved away from talk therapy to somatic practices and body-centered practices. And it seems like you don't really, and I'm sure, and maybe you can talk about this, you know, like when you're working with somebody, you might access something, some emotion, some trauma without any words, that gets metabolized and processed on the table.
And where the Reiki component comes in, like that's where I like start to channel these insights of things, right? Sometimes with certain clients, there's a really good chemistry and connection where that realm is available to access, right? So I could be working on someone doing really deep fascial work or working on some scar tissue, and then I get these insights that I channel through. or there's some insights that channel through me, where it could be like symbols or like sounds or feelings, memories, sometimes beautiful visuals of like nature, or like even obscure, like dark, very morbid imagery that like is very like still like psychedelic. And I'm like, oh, this experience, this thing that I'm seeing, this like gargoyle, or this like, you know, bloodied wings, or something like that, then I associate it with some kind of like archetype in 3D to the client. I start prompting them questions like, well, how are you feeling right now? You know, so talking to them, and then waiting and asking questions and waiting to see how they respond. And something comes up more like, whenever this gets to this point, something really deep comes up, and they express it to me, and I hold that space for them. And we work through that energy, that lesson. And while I'm holding on to that area of the body, or like, you know, if they're crying, it's like, you know, holding certain parts of their arms or their head, or you know, saying certain affirmations that help them integrate the experience of disempowerment, or what have you, because they didn't even know that it was there, or like it's like they didn't know it was there, but they knew it was a part of them. And so when it came up, they're like, oh yeah, that's the thing. But they didn't realize it was at the periphery of their consciousness, or like in their unconscious. So yeah, it's really powerful. So when they're able to share, and like they're experiencing that in their body, and we can move it around and help that integration, is just really, really powerful stuff.
It's like a story that's trapped that might be outside consciousness,
Yes.
but in the
Yes.
body.
Yeah.
What is Reiki? Like, and I mean, I know kind of, I don't know if I could explain it, but maybe just for the audience. And what I'm curious about is like what you learned, what Reiki is, what you learned first, and how both like fascial work and Reiki like complement each other. Like, could you do one without the other? Do you need both? It sounds like they both kind of require one another.
I guess the background story is that I actually met Talia through my Reiki master.
Yeah, Simone, which I've tried to get on this podcast, but she's so busy.
I love Simone, but yeah, Simone is my Reiki master. She was my RMT healer from ages ago, and she taught me level 1 and level 2. And so she had also a bunch of shamanic techniques within her courses for Reiki, which is incredible.
And she's super shamanic.
Yeah, so yeah. So Reiki is an energy therapy. It could be hands-on, hands-off. So it comes from Japan, and it's from his name is Usui. Like there's different sects of Reiki, but he channeled all this. Like I don't remember the timeline, but I think he was a Buddhist monk who created or channeled this Reiki and initiated people into it over time. And so usually the beginning of my invocation for Reiki, I can say it within myself or outside. It's I invoke the light of God within. I am a clear and perfect channel. Let this light be my guide. And the initiations for Reiki level 1 and 2, Simone or your Reiki master would open up your energy channels like over your head or certain parts of your body and your chakras to receive the channel. And so what happens is I invoke this non-verbally or verbally, and I feel this like shift in my body where I feel like I'm channeling this like light energy, and it goes through me, my head, my body, through my hands, and onto the client. Sometimes it just happens depending on the person and the situation. It just starts pulsing out of my hands. It just happens sometimes, right? And it can create this beautiful like ease and relaxation, and like a lot of people will feel like tingling, like minty joy, like almost like a sense of emotional grace, like they feel like they're touched by something very beautiful, like emotionally. They feel very vulnerable and soft, but in a very safe, grounded way, like connected to themselves. And sometimes it can be more intense, and they feel like something darker is coming up, because when you have that connection from the Reiki, you know, you're able to release things that are like not serving you, right? And so I think it really comes down to the receptivity of the client, or at least just where they're at, because some people don't believe in that stuff. But more often than not, the people that find me become open to it. People that never would have thought about it, where they were like, and then it just started happening in the session. And then they started seeing things and feeling things they never felt before and felt like it changed their life. So it's like very cool, right? So sometimes it just happens intuitively and it lands really well. Sometimes I invoke it. And it just depends on where the session goes and what the person's looking for. So I always say that I feel like I'm doing God's work. It's not like my own work. It's not personal. It's not personal to me. It has nothing to do with my wants and desires for the client. I set intentions every single time I see somebody that I want to facilitate what this client needs, the best of whatever they need to the best of their healing, like, you know, and kind of tuning into my guides, my spirit guides, Jesus Christ, God. And so I feel like I want them to guide me to help this person. So not to be like egotistical or dogmatic about God's work, but I try to have those intentions when I treat people. And so it just sometimes happens. And that's very like beautiful work, right? So I sometimes use it with massage therapy, sometimes use it with fascial stretch therapy. I find that when I use the combination of three, it's really incredible. And they do complement each other, especially when there is emotional release or trauma release happening, right? Or there's a lot of like resistance or something, right? So I would say they're very, very complementary to each other. And yeah, just depends on where the client's at and how they feel and what they're able to move through. And sometimes you don't, and it's totally fine, because it's just there's so many variables to consider regarding a treatment plan, right? Because sometimes no energy work can happen, but also like, what is energy work? What if I didn't even do Reiki, but their whole life was still changed emotionally in that session? Do you know what I mean? So it's like, at the end of the day, energy work is movement of energy through your body, and that could affect you spiritually, mentally, emotionally, physically, without necessarily doing these invocations or having this, what some people might think is woo-woo conversation, right? That doesn't have to take place. The point is that something profound took place and it helps them become more embodied, more connected to themselves. And then they go out into the world feeling that and sharing that or emitting that energy, which is amazing. So it's like, really, what is energy work? It's your body changing when you're in a healing process and becoming stronger, more resilient, you becoming more aware of yourself and, you know, embodied.
That's so, yeah, that's actually so good, because it's hard to define energy work. Like I have that problem as well. And I love what you said about your, like, I like, picture you as like a lightning rod, right? Like you're taking in energy is all around us. We're all energy. Like electricity, right, is harnessing energy, just exists in nature. Our bodies are electric. Like we contain energy. Like somebody said something about like the idea of chi, like our life force or energy force. It's like, well, chi doesn't exist. We can't prove chi. It's like, well, just think of it then as like metabolism or homeostasis. Like, what is the force that keeps your sodium levels in check? Like, it's electricity, it's energy, right? We are extremely, we're creating tons and tons of energy to survive. Like that's what a living being is. But then, you know, like nature change, like a rock changes over time. It has a metabolism of it's like, so energy is all around us. And so you're kind of like the lightning rod taking in, channeling a bunch of a collection of energy from the universe to the person. And then I also really love what you said about like, it doesn't have to be, you don't have to necessarily like mentally articulate that it's happening for it to happen. It can happen when
it has so many different forms, right? And so what I forgot to mention was it's ultimately the improvement or enhancement and self-awareness of chi, your life force. That's the point of Reiki or energy work. But energy work has so many different forms. Like sometimes it's like, you know, to a client, let's set these intentions for the session. Let's do a meditation, breath work, and like, you know, I'll do the symbols of Reiki on you or whatever, right? Or it's them having a conversation with me and me asking the right specific questions so that they can process certain questions that they need to really answer themselves that help them, or
Yeah.
or like moving their body in a certain way that it's all of a sudden eureka, oh, that thing that I was really pissed off about is, you know. So it's ultimately whatever it takes to improve your chi, your life force. I mean, going out in nature improves your chi. That's energy work, right?
I was just gonna say
So
like a
there's
dream,
so
like a
many.
profound dream. Yeah.
Yeah. Eating an amazing meal, like holding hands with your lover, like it's you know, someone like someone that you love hugging you, like that's all energy work. And so, you know, there's so many forms of that. But yeah, I just wanted to share that.
Yeah, it's like, yeah, like something is coming up for me where it's like it's sort of about, there's something about an experience of it, right? Like I had a dream a couple nights ago that stuck with me. There was sort of an aha moment in there, and like I was kind of tossing and turning and processing it, and then going back to the massage I got from you. I'm like, and I did get more, but you know, it's not like I can go and get massages, wonderful, and have wonderful experiences from practitioners and feel relaxed, and but there's something about when you unlock something or learn something, or there's like a connection that's made in our conscious awareness or a conscious mind, like something about there, something shifts, you know. And I think it's more than like,
Yes.
you can eat a meal and be satiated and regulate your blood sugar, or you can have a meal that
Yeah.
stands out for you forever, right? And the fact that years later it's a memory I have, it's an experience I have, like the way that someone remembers a vacation. Another person may not
Yeah.
really remember much about the vacation. Like we are changed in a certain way. And so it doesn't necessarily need to be an official practice, but it's happening all the time. Yeah.
Yeah. And there are so many people that are skeptic about this kind of work, but then I'm just like, movement, mental state, emotional state is associated with movement and vice versa. Like they're connected. Why is that why is that bizarre to just like admit, right? You know, anyone who's you're going through an anxiety attack, what happens? Your shoulders go up, you kind of just become into more like your whole posture turns to more in like a fetal direction, like fetal position direction. You're compressing your organs and like you're torquing your body in specific ways that are a result of this emotion coming up, right? Like some people don't even realize that they're clenching their jaw when they're stressed, right?
Right.
Okay, they're on my table with chronic jaw pain, right? Chronic neck pain, jaw pain here, and I'm massaging it gently, softly, and then like it relaxes and they start crying. And it's like, oh, like, you know, the memories are associated with movement and stagnant, like not even stagnancy, but associated with how we posture ourselves in the world. So why wouldn't movement and like stretching or like, you know, it's like gentle therapeutic touch affect that and release that, right?
Yeah. Well, and like here's an analogy. Let me know what you think about this, but like, so let's say I experience anxiety frequently, and it might start off as thoughts, right? Perceptions of my environment based on my experience, based on maybe like a childhood trauma. So my body responds in that like fight or flight response. I get the racing heart, the sweating palms, and I get this tension in my shoulders. And then over time, it's like Pavlov's dog. I don't need to necessarily feel the anxiety response or even have the thoughts to have this tension in my shoulders, like low level chronic tension. It becomes almost like a habit of the body, right? The way that I grab a glass is kind of the same. Like if, you know, when we're trying to relearn new movement habits, it's difficult to do. So now there's this underlying like tension. There's these like tension patterns in my shoulders that occur, you know, even below my conscious awareness. I don't need to feel the racing heart, sweating palms to get this tension and to brace against. Like if I'm living my life kind of always bracing against what my body thinks is going to happen to me. And so when you encounter that, you're like almost unraveling it. You're like, okay, we're starting with the tension, which is sort of the thing that never goes away. And now your body, now you're having this associative response where now your nervous system is maybe getting activated, but that anxiety is really grief. So now you're having this emotional expression of crying. And then, so we're kind of on, and then maybe now there's thoughts and maybe there's memories coming up and images, and we're unraveling that all so that you no longer need the shoulder tension or the jaw tension, to use your example. Like now it's no longer required.
Yeah, 100%. And that kind of speaks to why rehabbing postural dysfunction is so hard for majority of people and why it's such a chronic issue. I think that if you don't approach it holistically, you're kind of missing a huge block of healing. Like you're missing a big part of it, right? So you go to a physio and they're like, oh, let me fix this. And you're like, and you keep coming back with the same issue, but nothing's going on. But it's like, what if that stiffness, that tightness, or that injury is your body protecting itself due to an emotional pattern that is painful or traumatic, and it's just not ready to be released? Or unless you address those emotional issues, your body won't give up on protecting itself, right? So like you need to see that, and practitioners need to see it more in that way. Like, what is the root of that? You know, like emotions will affect our blood, our organs, everything, right?
Yeah.
And you can go medical the entire way and nothing will work until you address the perspectives, the philosophy, inner belief, core belief systems, and everything, right? And another thing that I was thinking of that came up for me was that, you know, a lot of people will come in saying like, oh, my stupid posture, or like really dysfunctional posture. And people have to know this, that what we think is dysfunctional is the body's way of protecting itself. Everything the body does is to save your life. And its way of telling you is pain and hurt and discomfort. And so there needs to be more like holistic or multifaceted approaches to this. And in terms of treating your body nicely and talking to it nicely, and not being ashamed or feeling disgusted or promoting this disembodiment by being like, oh, like this is what it's doing to me. Like it's stupid back, stupid shoulders. It's like, no, there's a huge, you know that there's a huge reason why it's doing that to protect you. Like it loves you. And it's just like, you need to work with it. You have to build a relationship with it on all levels to release it, or like, and even sometimes this means you acknowledging that this knot is not ready to be released. Not everything needs to be released. Sometimes it just needs to be like touched gently and made aware of for time, right? And so, you know, people come in to see me, oh, I just need the deepest massage ever. And like 10% of the time that's true, right? It's like their body screaming for attention. Yeah, it's their body screaming for like, find the areas that cannot breathe and make me come into awareness, give me attention, right? So like I love to approach this as less is more, and especially first time seeing somebody, it's like, my hands need to build a relationship with you, you know, forcing myself on you is not gonna actually be super helpful for the majority of people that come in,
especially
right?
with that like chronic bracing,
it's like,
right?
Exactly. Sometimes most of the time that's not the answer. Most of the time it's, let me introduce my system, you build a relationship with it, let me talk to your lymphatic system, build a relationship with that, right? Talk to me through the session, or not talk to me, but like I'm learning your body. And that, like, that's a language that like most people will not know, and that I'm only on like the tip of the iceberg of it, right? So it's nonverbal. It doesn't necessarily translate to 3D. It's a whole different language of what the body tells me and how I respond to their body, right? And I think the process is like them learning that language too, of what it means through me facilitating that, right? So sometimes it just takes me being gentle. But the thing is, like, I can go gentle, but I'm engaged. Like I'm listening to the tissue and I'm poking around in a way that's like, oh yeah, like you're alive, and I'm putting more life force in you. So people are like, oh, it wasn't just like a feather touch. They feel like the areas got targeted and they got worked in, but it doesn't have to be tight. Like it doesn't have to be deep, right? Sometimes it just means that I'm like literally bringing chi into the area, and that is enough, you know? And so not everything needs to be released. Sometimes it just needs to be managed, you know? That's one thing that people sometimes get caught up in, is like, I need to like release. And I've been guilty of that even to this day. Like I'm like, oh, I need this release. And I'm like, no, actually my pain right now is telling me a really important story, and it doesn't need to be fixed. It just needs to be like like acknowledged and like talked to and, you know, like held and like breathing through it, like really learning how to be still with that discomfort. And like a lot of people don't want to be uncomfortable, but unfortunately that's part of the process a lot of the time when it comes to listening to your body and healing yourself.
It's like a different type of discomfort. I just have this memory of Simone actually getting a massage from her, where there's this like knot that I developed in my first year of naturopathic school, writing notes or whatever with my left hand. And Simone, like, she had her hand on it and she's just like, what are you holding on to right now? And then she told me that it just dissolved. And it was so crazy because like I've been working this and I have like a roller and I have tennis balls and it's like
but then she asked the right question.
Yeah, it's like you're nothing. I'm not holding on to anything, I guess, because as soon as the question was asked, it was like, oh yeah, I don't need to be here, you know. And it's just this acknowledgement of it, of like, okay, you were here for some reason, you know. It's like those dreams you have where you have to go back to school because you failed stuff. I'm like, like I don't really need this knot anymore. I passed. I'm good, you know.
And then you acknowledge this memory or like holding in your nervous system. It's like, I actually don't need you anymore. And then it does wonders. You know, people are like, I don't know why this is happening to me. I don't know. Have you asked? Asked who? Just ask. Like in prayer meditation, just like, please show me what you're trying to teach me. Boom. Like mind-blowing life hack, right? Just like asking the question, show me the way, you know, what is this trying to teach me? And even just saying like, oh, I see you're holding, I see your pain, I see the knots, but I don't need you anymore. Thank you for protecting me. Goodbye. That's the most powerful stuff. And I use that with my clients all the time. You know, like, do you need this right now? No. Okay, tell me that you don't need this right now. And then their body literally melts like butter.
And then it's gone. And I have this experience so I broke my foot last year, the Lion's Gate around your birthday, August 8th.
I remember that.
And so this is the
Sorry,
experience.
can't come to your birthday, broke your foot.
Yeah, exactly. I was like, I can't drive, I can't go anywhere. This is horrible. The experience was like this. So I fell and it was like kind of an acute pain and acute situation. I thought it was a sprain. So I went 3 days without getting it diagnosed. I was like waiting for it to get better. And if it wasn't going to get better, I was going to get an x-ray. So that was one experience, right? I didn't know it was broken. So I was kind of still walking on it, putting ice, expecting it to get better. Once I knew it was broken, it changed my relationship with my foot and the way I handled it and the way I was with it. Like I was scared to sleep in certain positions. Like I had this image, right, of a broken bone and how you're supposed to treat and be in relationship to that, the healing process and everything like that. And about a couple weeks out, so they put me in this boot, and so I'm like totally immobilizing it, whereas before I was walking on it, which is wild, you know. And so I'm like, after a couple of weeks, I started to get this really intense calf pain, and I remember like it was so painful. I was crying. I was doing my own acupuncture into the calf, being like, it's probably a muscle knot, and it wasn't getting better. Acupuncture, like deep, like pressure point, trigger point acupuncture, nothing was working. And so I was like, and it was horrific pain and like 8, 9 out of 10. So I ended up going to the ER because I was like, I waited too long to get my foot diagnosed. Maybe I should go to the hospital because maybe it's a deep vein thrombosis.
It's a blood clot. Yeah.
Maybe it's a blood clot. Like I could die. Like I need to go now. So I went like 1 a.m. to the ER. My sister-in-law was working there. She's a nurse. I'm like, I'm just going to go while she has a shift. And like, and I go and they gave me like an anti-clotting medication. And they said, come back in the morning to do a Doppler ultrasound. And I was like, oh my God, okay. Like for sure it's that. And like, and then, but they were kind of feeling it, being like, I don't know, it's like 50-50. Like it could be a muscle knot, but it could also be a blood clot.
Yeah.
And then, so I got the ultrasound. It's not a blood clot. So either the anti-clotting thing fixed it or it was never a blood clot. The pain was gone by the end of the day. And I was like, wow, like it went from being the most excruciating pain ever to non-existent. And I had a similar experience in Vipassana meditation and a 10-day retreat where pain, it was like almost like a beaver dam that like when I am noticing pain in my body, the tension that I meet it with is what causes the suffering and the pain and the discomfort. And it like almost creates this friction of intensity and suffering in my consciousness and in my perception of it. And I don't know exactly how to describe what happens, but it's almost like an allowing it, or just removing that beaver dam, which is my own tension at the pain. It goes away. Maybe there's still a sensation, maybe there's still a throbbing, but it becomes just a phenomenon to observe. And like there might be intensity in it.
Yeah.
But it's not pain
honestly
anymore.
And you'll find, like, I was just listening right before a call to this like this person in a university talking about fascia. I was just like, I'm just gonna like listen to this person speak about it. And a lot of what you'll find in these kinds of conversations in universities about fascia is like it's not lengthening your tissue, it's actually tricking your brain into perceiving stiffness and mobility, so it's like reconfiguring your brain's perception of it. So like a lot of it has to do with that. Not all the time. Like there's levels of, like on the scale of, when someone's neurotransmitters or like hormones are completely out of whack, you could think about, like, you could like surrender to pain all you want and you're going to be in excruciating pain. People that struggle with chronic pain syndromes and everything. But I mean, I've struggled with that myself, which is why I do what I do. Right. But yeah, there's a huge portion of it that has to do with like your relationship to pain. Like how much are you resisting in this pain? You can even use examples of like grieving a relationship, right? How much of your suffering of the relationship is actually like your unrealistic expectations and attachments and stories that have nothing to do with love, have nothing to do with, it's like it's like you're sabotaging, part of you sabotaging yourself to experience more pain, right? So there's a level of resistance when it comes to a lot of pain. And just like acknowledging it and like melting into it, I think can be really, really helpful in a lot of cases. I was just treating someone yesterday. They had a minor fracture on their ankle. They've been in a boot for a couple weeks, 3 weeks. And they were like, oh, like, please be careful with my ankle. Just be very careful. They're very gentle. And so like every time I go near it, like, but then like I left that as the last thing I treated, just so I didn't want to aggravate it. And like, they were so relaxed by the end of it. And I went to their ankle and I was doing gentle lymphatic, like very soft flushing in the area because there was a bit of remaining swelling. And they were like, oh, that's so nice. That's so nice. I'm like, so it's feeling fine? Yeah, I feel so good. And I'm like, they're like, oh, that's my bad ankle. And they tensed it up and they were like, ow, ow, ow. And I'm like, yeah, are you listening to yourself right now? And they're like, oh wait, it doesn't hurt. Sorry. I'm like, don't say sorry. Firstly, people tend to say sorry so much on the table, but it's like, don't apologize to me. Like,
but isn't that crazy?
This is amazing. It's an amazing example where it's like, your ankle's totally fine.
Yeah, it's like, I mean, your ankle's broken, but all of the inflammatory fluids and everything are immobilizing it, and the cast is just there. Like now I learned all about bone healing, and I've had patients come to me when they break bones now. But I'm like, it's interesting because there's so many metaphors in it. Like, first of all, you can't rush it. No matter what you do, what you take, what your mindset is, it still takes 6 to 9 weeks to 12 weeks, whatever, a full year to fully heal it. But you're back maybe doing your normal activities in 6 weeks, let's say. It's the same process like giving birth. It's like still 9 months. It doesn't matter like what your mindset is. Like it still takes 9 months to have a baby, more or less. And there's one metaphor. The other one is that the less you do, like the less intervention, and even the conventional system, now they just put you in boots and they like partial mobilization, no more plaster casts, because the less you favor it and immobilize it and like kind of remove it from your experience, the worse the healing process is, because now you have to like rehabilitate. What I learned in physio, because I went for a couple of physios after, is what I wanted them to teach me was, what can I do with my foot? And it turned out pretty much everything. But what you're not doing with your foot is a result of the nerves around the injury limiting themselves to what they think is possible. And so what rehab is mainly about is like getting the nerves to reform their connections again. Like there's trauma in the nervous system around the foot where it's like, don't do that. Don't dorsiflex, don't invert, like just, you know, and so to like move, like what you were saying, like go to the range of motion, go to the end range of the joint. Let's start moving blood flow back in. Let's teach the nerves what they can do again so that it's like it was before. That's the process of rehab. The actual bone is now stronger than ever because it's been reinforced with all this collagen connective tissue, but it's the nervous system.
And stressed.
Yeah, exactly. So that's so cool, right? Because it's like our perception, how we view injury. My friend told me he broke the same foot, the fifth metatarsal, 1 year, and then the other foot the next year. He's like, the first year I was like scared to do anything. I had a cast. The next year I just like maybe put a boot on for a week, then just wore a shoe, tried not to run. It healed just as fast or faster. Like I just kind of forgot about it. And so it was this like mindset way in which we deal with it that's so interesting, that like so much of it is in our fascia and our nervous system.
And so we have to consider that the more we control, the more we resist, the more stress we're putting on our nervous system, and it's an unhealthy stress in parts of your healing
process. You have to put a certain amount of stress on your body to heal and overcome that adversity, that injury. But when you're adding on top of that this like level of resistance, that's going to that's going to make it doubly worse, right? It's like it won't actually contribute to your healing. You have to surrender to that process, however long it takes. And when you actually allow it to happen, you give it the space to breathe and be itself. You can use these like examples with people. You're trying to lock somebody in their room to not go out and explore the world all day for days on end. It's like, no, like they need to be out in the world and explore, right? And be challenged and stressed to a certain extent to grow, right? So we have to have this level of surrender to the experience so that we can heal properly. And you have to address your core beliefs and your mental patterns to work with your body that way.
It's so cool. Yeah, it's both like body, mind, body. What about lymphatics? Let's talk about the lymphatic system, because that's also I'm a very lymphy person. So this is like a topic I love. But what is the lymphatic system? Let's start there. I don't think I've talked about it really in my podcast, which is wild.
Oh, it's a fluid system. So you have the blood and then you have the waters, right? So the lymphatic system, you have like lymph nodes all over your body, right? If you look at it like anatomy, you have like this web, like this train of they look kind of like veins in the anatomy, but they're not. They're just like all over your body. And the major clumps of lymph nodes, they exist at every like joints, like the major highway intersections. They're at major joints. Like, firstly, the lymphatic system helps bring nutrition to certain areas of your body. Like they help detoxify, they help, remove waste and toxins, right? So the lymph nodes are part of that process. They can become enlarged when there is bottlenecking of toxins, or like some lymph nodes are like damaged, some lymph nodes are like infected or something, and so they're not able to like detoxify properly, right? And so you get like lymphatic cancers or lymphatic conditions like edema, especially when there's injury points, like you broke or you hurt your foot, right? Like you had a lot of swelling. There's lymphatic injury there too, right? So the lymphatic nodes, like the main clusters, like I was mentioning, they all exist by like most of your joints, right? So you have one of the main ones, which is your clavicle, under your clavicle, big clusters of lymph nodes there, under your ear here. Just
like when you're sick, swollen, tender.
Just under here. Yeah, exactly. So you have under your ears, like people listening to this right now, poke right under your ear, just like under your jaw, see if it's swollen. A lot of people will be like, ow, I didn't know that was there. And then you have like, I'll just move this. You have like your pecs over here. You have your armpit, your axilla. So many lymph nodes there. When I've treated women with having double mastectomies, they have massive arm edema, like massive, like it's huge because they removed lymph nodes in the armpit area. So when they remove like dozens of lymph nodes, that's supposed to help bring the fluids back up to be detoxified, but because they're not functioning, they're all swollen. All the waters are like stagnating in the area there, right? So I have to manually push it up. And then you have your abdomen, which has the biggest lymph cluster, lymph node, the sternochyli, which is just like in where your diaphragm is, or above your navel. And it's the biggest one. And, you know, I love that area. The abdomen is like my favorite. That's where the fascial systems start, biggest lymph nodes, your organs are there. And so like when practitioners don't treat that area, I'm like, why? Like it's literally the most important part to treat. And then you have like your groin, under your knees and your ankles. So like those are where the big clusters are. And so that the water systems help keep us alive and healthy. So when you're experiencing stuff like brain fog and exhaustion and bloating and inflammation, your lymph system is so taxed. Like it's not functioning properly. That could be due to like autoimmunity or like illness, emotional stress, trauma, poor diet and lifestyle. Sedentary life is a big one. Like if you're working all day and you're on your computer, like you are stagnating your lymph system, because listen to this, your lymph system can only be stimulated either manually or through movement, or but specifically muscle contraction. So your lymphs, like they don't necessarily work themselves. You have to work your lymph system, right?
Not
so
like arteries or
when
like
you
your
work
heart.
out,
Yeah.
no, exactly. So like you have to contract your muscles to help pump the lymphatic system, right? So movement, walking, muscle contraction, there's also dry brushing, you know, so all of those things. And even sometimes heat can stimulate it, like sauna, right? But it's definitely like an active process of stimulating it. So, you know, you see a lot of people with all this inflammation. It's like, what are you doing? You're like, are you doing these things? You know, are you hydrated enough? So I'm pretty obsessed with the lymphatic system. I had about 2 classes in it in massage therapy school, which I just don't understand. I've continued my education to pursue lymphatic health education, like continuing education. One of my teachers is Dr. Perry Nicholson of Stop Chasing Pain on Instagram, and he blew my mind of his wealth of knowledge of lymphatics, and like similar story, like of why I became fascinated with lymph. Like he was super sick, had cancer, and had all these illnesses. He felt horrible, massive brain fog all the time, sick all the time, low immunity, like rashes. All those things are symptoms of poor lymph flow, right? And he started to teach himself about it. And by the way, he's just, I think, like just a chiropractor, but he now is like this holistic health doc, you know? So he did all his research from like the beginning of lymph time, like wherever he found the earliest lymph research, he like tracked it down and pursued all these different kinds of modalities to contribute to lymph healing. So I took his workshop, Lymphatic Mojo, and it was amazing. But I learned so much about it, including that the fascial systems start at the abdomen, like, right? So like the umbilicus, right?
Oh yeah, totally.
So it's pretty cool. Yeah. So so lymph stimulation can also be tapping. So you have dry brushing, tapping, like, you know, like tapping the areas, but all of these techniques are like designed specifically for certain people. Like it's not for everyone. And the amount of stimulation of lymph is specific to the person, because sometimes it's too much for a certain person. Sometimes, you know, you have to kind of just like see where their illnesses are, or like what kind of health issues they have. So I became really passionate about it because I was having these health issues and I felt swollen. And when I started to address my lymph, I was like a totally different person after that. And then my sister got lymphatic cancer around the same time. And it was like, whoa, like the lymph is so important. And so her and I had this like journey together, understanding like
and associated with even trauma and
you know, how it like pools in your body. So like I've had like a really passionate 4 years of learning about it. And so what I use it for in my treatments is so lymphatic massage. There's different kinds of lymphatic massage. In school, we're taught this very slow lymph drainage techniques where it's kind of just like you start at the part closest to your heart and you're kind of just like, this is not where I would start, but like, it kind of looks like you're kind of like doing, can't even show you, but like, it's kind of like can't even.
Yeah, I can see it. It's like very gentle pressure, right? Like
it's
otherwise
very
we
gentle.
more sure.
It's like yeah, it's very gentle. Like you're kind of pushing all the way up towards the heart and you're kind of trying to push the fluids back up. It's very relaxing. I don't do that one. I do my own intuitive combination of what I've learned through different practitioners, including Dr. Perry Nicholson, Sue Sheedy. She was the owner of Toronto Bodyworks Massage Therapy downtown before it closed down. So it's like, I do a more brisk lymphatic massage style. It's still light, but it's brisk. And like, it's like fast, right? Like I go faster and I follow the principles of lymph flow in terms of the direction and like where I start. And so I always start with that with people, even if I go into deeper tissue later, because less is more for one. Like when I received this treatment from Sue and Sue's practitioners, I was like, oh my God, this is life changing. Like I didn't even need deep tissue work. I didn't even need trigger point therapy. I didn't even need cupping or whatever, right? I just needed my lymph to be like flushed. And I looked like I lost 5 pounds after the treatment, or like 10 pounds. I don't know. Like it's just crazy. It's honestly crazy how much we hold in terms of bloating and inflammation day to day. And so I was like, okay, I'm going to learn from Sue one of these days. And I did. And she taught me how to do the whole series of like just flushing. She calls it flushing. So I do that to all my clients. Sometimes it's the full session. That's all I do. I have clients who specifically come to see me for the lymphatic drainage. They love it. It's super relaxing. They're draining, you know, and it's wild. Like I had a friend who came to see me like last fall, and she was very like, I thought she had gained a lot of weight. Like she was very much bigger than I saw her. And I felt like, and I was like kind of touching her legs, and I was like, this is like not fat. This is swelling. And she was like, oh, really? And so I did this like series of lymphatic strokes and pumping and stimulating and stretching to open up the lymph vessels, so when the fascia is constricted, your lymph isn't going to be flowing easy, right? So like addressing
like smushing
all those
it or
things,
preventing it from flowing.
Yeah, it's like smushing it. So when you're like mobilizing the fascia, you're mobilizing the lymph. And most of the time I start with mobilizing the lymph and then the fascia, because now the fascia is lubricated, right? It's more like fluid versus viscous. Yeah, so it slides better. And so I did all those things, and honestly, the next day it looked like she lost 10 pounds. I couldn't even believe it, and it's continued after that. And it looked like she lost 40 pounds. And I'm not claiming that it's gonna be the thing.
So it just got
I'm not trying to sell this, but like, oh my God, it was wild. It was crazy. And the majority of people that take Dr. Perry Nicholson's course, like they all have crazy stories.
Honestly, by the end of the week she was with me, she looked like the person that I was friends with to begin with. Maybe, you know, it's like,
I couldn't believe it. Like, it was all swelling. And I'm like, this is wild. Her energy went up. Her brain fog went down. You know? And also she became more emotional because water is emotions, right? And so like she was releasing emotions as the water's drained.
I wonder about this too, right? Because like I'll have people come, like, I mean, well, obviously weight loss is a major concern that people come in with. It like guides people to see a naturopath, a practitioner. It's like, I want to lose weight, or they kind of like will bring it up. They'll be like, I know you do mental health. I also want to lose weight. And the associations, like, I'm always curious with the map, right? Because a lot of it is societal. Like what is weight anyways? It's like, what is body fat? But a lot of, you know, so one of the things we use, like differentiating, like, where's the weight on your body? Is it like just bloating, like air in your intestines? Is it, is it fluid accumulation? Which I think in my case, like if there's a lot of fluctuation in weight, it could be fluid. But I even find that you could be holding on to like a set chunk of weight on the scale that is actually just fluid, that isn't necessarily fluctuating. People are like, oh, my weight doesn't fluctuate too much, but it could still be like a 20-pound amount of fluid in your body.
I get 100%. It is actually crazy. And I learned this in a very interesting way that I did not intend to, because I've always had issues with my weight, you know, but I think ultimately I've had issues with my lymph, because if your body is not detoxificating, if it's not removing waste properly, it's accumulating waste. So you can put you can take as many supplements, you can work out as much as you can, but if it's not removing waste, you're not going to be losing weight or like burning fat or feeling good about your body. Like so you need to address your waste systems before thinking of making any changes, right? And so I was having weight issues, whatever, and then I went camping for a week. Just at Killarney Provincial Park with my friend. I was really frustrated going because I was like, oh, I brought my clothes, but none of them fit me. And I was like, I have all these food intolerances. I can't eat anything, but I brought food, whatever I wanted to eat. I was like, you know what? I'll bring the best I can, whatever I'll do. I was really stressed. Like, I can't eat this. I can't fit in my clothes. Blah, blah, blah. So I was off my phone by the fire, cooking food, and going on hikes every single day, kayaking, you know,
swimming,
and
moving.
by the end of the week, but the thing is, I was working out in Toronto. I was doing all these things. I was eating well, but it wasn't working. Okay, so I'm out in nature, and by the end of the week, I was like swimming in my clothes. I felt like it looked like I lost 15 pounds. Like, it was insane.
And like, just for the audience, that's not,
I had like
you don't,
all this.
The human body can't lose fat.
No, it wasn't. It was swell. No, it's not fat. It's not fat. It's like bloating. It's like inflammation. So my nervous system had a chance to regulate out there because of lack of, so also the things that we can consider that can contribute to like inflammation is stress.
And fluid retention.
If we're constantly stimulating ourselves, and stressing ourselves out, what happens to our hormones? You know exactly what happens. Cortisol shoots up. And when it's too high chronically over a prolonged period of time, your hormones go crazy. And then it starts to do things like hold on to water and fat to protect itself, right? So this is also where the nervous system comes into play about reducing inflammation. So you want to lose weight, you want to look better, lessen the stress in your life, right? That's also a huge one, because I felt so good after. I couldn't believe it. I felt so small. And I'm like, this is actually who I am.
This is my body. And you know what? What's funny? The funniest part is that like by the end of the week, I was able to eat whatever.
The things that I was like intolerant to, I was like eating prosciutto, chips, and like crackers and cheese. I'm like intolerant to dairy.
That's awesome.
And like when I'm having too much of these crackers, I'm just like, I get sick, I get gut rot, and I get bloated, right? In the city, of course. So then I was like camping, I was like just eating whatever we had left by the end of the week, right? You're just eating whatever you have left.
Yeah. It's okay.
And I was fine.
The same thing happened to me like on a vacation. Like, I was swimming in the ocean a lot and my arms.
Yeah.
But I was even going to say before, so like this thing where people are like, you know, I want to lose weight, and then they'll describe their conceptions with the weight loss. Like, I just feel heavy. I feel fat. And, you know, in our like diet culture thing, we always say like fat is not a feeling. But I think about this and I think like, you know, putting on 10 pounds of fat like is not, it doesn't really feel like anything. Like, unless you're stressed, unless it's fluid, then it feels awful. Like that, how you described it, where you were like, I can't fit in my clothes. I feel swollen. I feel bigger. I feel puffy. I feel fat. Like, that's not necessarily body fat. Like, having those negative, like, we have a negative association with fat in our culture, all that stuff, like body image stuff. But I feel like, and I have this, you know, I'm like all like pro body image, like we shouldn't focus so much on fat loss, like we got to focus on like holistic healing. But I have this memory and this experience of a patient who came in and she kept complaining about her weight, and she was like, my thighs are huge, I don't know. And she was an alcoholic, and that was sort of like part of her concern, and we were working on that, and we ran some blood work, and her estrogen was off the charts, which is going to contribute. There's a Goldilocks effect with all of our sex hormones. Like, when estrogen's too high, it's going to create a bunch of symptoms, like weight gain being one of them, and fluid retention. And then if you're, you know, the reason for that was that her liver is busy processing the alcohol and wasn't able to process the estrogen. So that in and of itself is going to cause issues. But when our liver is congested, it's going to affect our lymphatics. And so what she was describing, I was like, at first I interpreted as like, oh, there's a lot of like body image issues and even some dysmorphia I'm seeing. And I'm trying to orient her to like a better, more holistic goal. But then I realized I'm like, no, she's trying to articulate. She doesn't necessarily have the language to describe exactly what's happening. What she has language to describe, the language she has is like, I feel fat. And so it was a lesson to me being like, listen to the person, because
she feels toxic buildup.
She feels
waste building up, and she feels disgusting.
And she feels disgusting. And so she's saying it's fat. I feel disgusted by fat, but I'm like, it wasn't that. That was what she was trying to communicate. And so I was like, wow, okay, yeah, we have work to do. And it's not about, and then this is the sad part, right? This is why I have this course UA Less on the Moon, because I'm like, what she would do if she hadn't come to see me and we hadn't started unraveling the pieces is that she would have joined some sort of program, let's say, to restrict calories and to do like cardio to burn calories. It would all be about calories, which is that's just going to worsen the stress response, possibly deprive her liver of the nutrients it needs to function better. And it's going to worsen the problem. Yeah. Right. So we have to understand the problem before we can solve it. And so it's like, in your case, it's like, doing all the things you were doing was like watching my diet, doing crazy amounts of exercise. It may have been worsening what you're experiencing, and taking it all away.
Yes. Well, if you think about it, all the things that I'm doing requires elimination. It requires like my organ.
Eliminate something, but if it's not eliminating, breaking down like all the protein, lactic acid, because I'm doing that properly to begin with.
I'm literally adding more to this like clogged drain.
Right.
And I'm stressing my body out even more. So like when like you're constantly stressed and it's like, do less, like be still, like actually like, and sometimes it's like, I want to stay in my regimen of working out, but then I'm like, I don't know, like it feels like, I feel like I'm not healing right now. It feels like I'm not actually adapting. So I spent a week not exercising with my weights or whatever. I'll just be out in nature, hiking and stuff like active recovery, swimming. And then I'm like, small again, or like my bloating goes down because it needed time to heal. It needed a more passive, like gentle processing to or it needed a more gentle way to process all these things, right? And again, like the darker side of like even anti-diet culture, where it's like, oh, like you have body image issues because you feel disgusting because you feel fat. And it's like, and I've explained this to people before, it's like I don't hate my body because I'm bigger. I feel disgusting because I'm accumulating waste. This is not what I want to look like or feel like, right?
It's an intuitive sense of something being off, right? And if you listen to someone, they'll say, I don't feel like myself.
Feeling bigger for me feels like toxic buildup. And that's generally always the case for me, is that like, I feel the bloating, I feel the itchiness, I feel just like not in my body. Like it's like there's gross stuff all over me that I can't shake off. And so treating my lymph and like doing things to promote lymph healing, which needs a holistic approach too, like removing stressors, like addressing your core belief systems. Like I was saying, everything has to do with all these approaches, right? We have to see it this way to actually like see what's going on. And it's also so different. Like you can have all the programs in the world. I've tried all this stuff, right? It's like, it doesn't matter. Like you're different. You could be an anomaly to the program, right? You have to listen to yourself and see what's going on. And you did an amazing job to listen to your client and be like, oh yeah, like this is what's going on in her body. Like you went deeper and you figured out that there was something else. And now you're making way of an awareness to approach like when people say they feel fat, it's like they actually feel toxic.
What do they mean? Yeah. What do they mean by that? Right. Because there isn't really, like I've gained 10 pounds, lost 10 pounds. It's more the fluid. It's more that like feeling dirty. And again, it's hard to say this stuff because so much of it is wrapped up into body image stuff, but we have an enteric nervous system that tells us if something's right or wrong. Right. And we can say like my shoulder hurts or my brain feels foggy, and we can feel like our stomach feeling bloated and it the word we have for that might be fat, but that's not necessarily what we're talking about. Like what, you know, when we say it, like it's inflammation, it's fluid retention. And then this is important, is that the solution is not self-hate and punishment and trying to burn calories. That's the anti-solution. So that's also important too. It's like, let's acknowledge that there's a problem, and then understand why it's occurring, and then provide the appropriate solution for it, which is sometimes the opposite of what you think it would be, right? It's not Weight Watchers, it's reducing stress, exercising less, maybe letting go of food restrictions, and you know, maybe to a reasonable extent, right? Because some might be causing inflammation, and then body work, and then moving lymph, and crying out the emotions, releasing water, which is like, crying is another way to get rid of water.
Yeah, especially for women. Especially for women, and in programs like exercise, movement, health, and wellness, like they're so targeted to men and the way that men function in the world. And finding, the more I work with women, the more I work with other healers, it's like the wild variety of our experience. You know, like I was talking to one of my other healer friends, and she was like, oh, I'm trying to fit into my wedding dress, and I've been working out, but I've been going through some like emotional stress lately. And I just felt like I wasn't like burning my fat. I wasn't going down a size, even though I worked out so much. And then she had this intuition to just stop. And it would go against her programming. It would go against the consistency of showing up for herself. That's a linear way of seeing it. Whereas she realized at that point in her life, she was navigating with her stressors, like what is happening right now, and her capacity to handle these stressors. So level of resilience, right? So she's really good at that. And so she recognized that this is where she's at with her stress, and this is what she can take on. And therefore, this is how much rest she needs for it, because she knows herself, right? So she removed the stressor of working out. She dropped the 10 pounds. She slept more. She ate more. She stopped working out. She regulated her hormones. She became happier and more joyous, less irritable and like tired, you know, and she just stopped like using weights, for example, not stopped moving or active work, right? But like still stretched. She still moved and walked, hiked, but stopped lifting weights and dropped the pounds and got that body because she listened to herself. You know, she listened to herself and she started to heal. And it's so not black and white. It's so different for every single person. And we all have to be willing to see what that means for us, even if it means it goes against the rules of like what our programming or programs like that we follow, or the books and the podcasts and the websites and like what this Instagram said or self-help said. It's like, no, like see what's going on with you.
It's really hard, right? Because you hear all these voices. Like I follow a lot of fitness inspo people on Instagram, and I see their workouts, and then, you know, intuition kind of tells me, you know, you always feel better when you're regularly doing yoga. It's your rest. Like there's things I love to do, like surfing, which is quite stressful on my body because it's like long sessions, and then there's the yoga that balances it out, and that's my recipe. And but I think too, like, and this kind of brings us back to the beginning where it's like talking about participating, where it's rather than being a passive recipient of health or whatever the intervention is, like what does stress feel like in your body? Because I have and sometimes I like it. Sometimes I like the like revved up feeling of cortisol. It's like I'm drinking coffee and I'm like walking fast, and I'm swimming and I have this like I'm burning kind of feeling. I am productive. It's a very like young, you know, but I know what that feels like. And so it's like the RPM in my car. Like I can see it revving, and then I kind of know, even if I don't want to acknowledge it, there's an awareness that the antidote is to like relax it a little bit, right? So because someone listening to this might be like, okay, well, weights, should I not be doing weights? It's like, well, weights can occur in the context of like weights could be very healing to the nervous system, because it doesn't have to be super young, right? Like you're just applying resistance to your body. It actually could be like not spiking cortisol too much. A walk could be super soothing, or the way someone else walks could be very cortisol boosting. So it's like, how does that feel? Right? Like, how does fasting feel? Does fasting feel like you're giving your gut a break?
What stresses you out?
Or does it feel like, for me, it feels like I'm hungry. Yeah. You know? And
just like,
so when we
oh,
ask
what I
these things,
love
like
to
people
do.
like, it's like, it's like it's an honesty, but it's also an awareness of like, okay, I know what cortisol feels like at the end of the day,
Yeah.
when I feel kind of like buzzy and like fried, that's the feeling.
Yeah.
And this is what we're doing, so our, and again, so much of it lives in the nervous, like we talk with polyvagal theory, and like this sense of like, how does my nervous system feel? Like, how can I identify where I am on the ladder of like fight or flight, shut down, or safe and social? Do I know where I am at any given moment?
Yeah, this is wild. Like you could tell someone to do yoga, but what if yoga stresses them out, right? It's like,
Totally.
then don't do yoga. But
Mhm.
also, side note, yoga is an incredible tool to train your fascia. It's so good.
Good. That's maybe why I like it.
You want healthier fascia, you want to do
Mhm.
yoga. But
Mhm.
outside that, it's like you have to see the most powerful thing you can do as a healer, a practitioner, is like to like teach or facilitate awareness to your clients of like what actually stresses you out, you know? So like weights can be really good, or you can modify weights, right? I had a client who was like, oh, I'm doing like hip thrusts, but I'm in excruciating pain after and I'm limping the next day. I'm like, then don't do them. She's like, what? And I'm like,
But what about strength
modify them.
training and
Just do
muscle building?
just
Yeah.
yeah. And I'm like, just do modified banded body weight
Mhm.
hip thrust. This is not your exercise. If you're in pain or like exhausted after a workout, that's not the workout for you. That's not where you're going to meet your needs. You can't
Mhm.
keep pushing through pain. Like that's not how it works. You push through a threshold of stress that is safe enough for you to grow your muscles and like to get healthier. But it's like a line, and most women cross that, right? And another comment for stress and how crazy this is: massage therapy and body work can be too stressful for people.
Mhm.
That's a stressor, because what does massage therapy do? It's, you are still putting stress on the nervous system to eliminate waste that's
Mhm.
going into your organs, into your heart. And so like I've learned this myself the hard way many times, where I'm like, I'm really stressed out. I'm really, really stressed. I feel like I'm gonna like collapse into a nervous breakdown or something. And then I go get a massage and then I collapse into my nervous breakdown because it was like too much. I was like, I need something, I need to fix myself. I need to fix this problem. What I needed was to sleep and not
Yeah.
continuously stimulate myself. Massage, body work is stimulation. Therapy is stimulation too, right? So sometimes it means resting and not constantly putting your body through something.
Yeah. This is like, I think it's Molly Galbraith or someone I follow on Instagram, where she's like, your body's built not through the exercise you're doing, but through the rest you do afterwards. And so, like, we don't think of that, right?
Yes.
When you're lifting weights or whatever exercise you're doing, you're breaking down your body, and then it gets
Yes.
rebuilt
Yeah.
once you refeed and once you sleep. And similar with fasting, it's like you're inducing a whole bunch of stress, and then the response afterwards is the healing piece. And but like, so when we're saying these things with people, like, okay, do I lift weights, do I not lift weights, yoga, yes or no, do I do body work, or is it gonna be like,
Yeah.
what are, like, how would somebody know, like, what are, and again, this might be stressful, but to the individual, but like, what is it? Like for me, I was saying, like, I can kind of feel what it feels like to have cortisol in my system. Is
Yeah.
that it? Is it like, is it trial and error? Is it, maybe someone like you who can read energy can feel like, maybe we should just do Reiki, or I can kind of adapt my practice today, even though you want something hard and intense. I think I'm just gonna,
Mm-hmm.
move a little bit of energy, bring in some relaxation.
Mm-hmm.
Yeah. How
Yeah.
does someone know?
It's hard. Like, I mean, I do this as a professional. So like I've revolved my entire lifestyle around it, but I still encounter like making these mistakes. But it is a learning process, right? You want to learn more about how to figure that out. Find your holistic health care team. Get your naturopath, your healers, like your shamans, like your therapists, like your body workers who know what they're talking about. Hopefully from their own experience too. And also like just really start to like listen to yourself, because the wisdom is, so what we are doing, what you and I are doing, are mirroring what they already know, right? We're basically mirrors to show them what is already happening, and that they have the tools to help themselves if they want to co-create the experience, right?
That's
so
true. Yeah. Mm-hmm. Like
yeah,
it's
and I
gonna
would,
resonate for someone. Yeah. Yeah. Like if someone's like,
you
oh,
know,
I'm lifting a lot of weights, maybe that is stressful for me. Whereas another person might be like, lifting weights actually feels fantastic. And that's my stress relief.
yeah,
Mm-hmm.
exactly. And accepting that it changes, especially as a woman with like your hormone fluctuations, like that will change. Like your programming and your capacity to add stress or remove stress changes with your cycle, you know? So, and so for me, when clients come in and they're like really stressed or feeling really neurotic or whatever, I go slow and I do techniques that just like are gentle and engaging, but it's all very intuitive, right? Like I try to help them come back to their body and not be overstimulating. And if I really feel in the session that like it may or not benefit, then I try, I've never stopped, but I will like encourage a change of a plan or something like that. Or I would encourage them to seek out other practitioners or like a referral network for something else that might be going on, right? But it comes down to listening. Ultimately, we know, like, what you need. And so the process of healing is kind of peeling back the ignorance we have about stories we've told ourselves about what it looks like to be healthy, what it looks like to, be an optimal human. I mean, I like the whole thing, you need this amount of protein a day. I know you love protein, so no offense to that, but it's like, I felt so hungover yesterday from a whole weekend at my friend's cabin eating so much meat.
Mm-hmm.
I felt literally like I drank a bottle of wine the night before. Okay. My
And the
body, I'm like, oh my
nitrates.
God. But in my head, I was
This week, I need the protein, but it's like, that doesn't matter. Sometimes we need breaks, right? And
that looks different for everyone.
so I spent 2 days
not having any flesh protein. And I woke up feeling great today. My body's metabolizing it slower and it needs time. But it's like, there's so many stories that could tell me like, but protein's supposed to be good for you. It's like, well, I had too much. That's too bad.
And here's the thing. This is actually really important, I think, for everyone listening who follows me or Nicole or any other practitioners, is so we're clinicians, right? So we work primarily like we're patient number one, right? Like because I know way more information about me than I know about anyone else because I live in this body and this mind and I have all my, experiences. So I'm learning using myself as an experiment. And then I'm a practitioner. So I work one-on-one with people and I'm learning from their experience. And then when you put together similarities, you can start to develop content to educate the public, right? That now it becomes more like group therapy. So, and I've run groups, right? Where it's like, okay, there's similarities in the group, there's similarities across the population. I just had a conversation with a patient, right, who is completely not the typical person I see, right? He's like a very different needs, different age, different lifestyle. The advice that and I wouldn't hope it's not advice, but it's not supposed to be advice. It's more like it's education, right? It's like consider these things for you and apply them to yourself. But for that person, it would be terrible advice to follow certain things, right? Yeah. This person like has no appetite, needs to be gaining weight. So it's like the opposite, right? We want to stimulate insulin in this person. We want to stimulate hunger.
Yeah.
The average person with metabolic issues, which is the majority of people, that's a terrible idea. So more protein is good for them. But so it's like but this is the problem, right? Is that we get so much of our health inputs from Instagram. And a lot of the people who are speaking on certain topics, so I don't really know where they're scaffolding their information from. Is it clinical one-to-one work? Is it group work? Do they have experiential data or do they have like a program where they've gotten lots of results and so they've accumulated different stories from people to see what works and what doesn't work and what the variability is in the population? Or are they just imposing kind of general things that they think are a good idea onto us without any of that like meat and potatoes that underlies the claims that we make, right? And this is even true in research, right? Someone would be like, show me the reference for something, show me the research. But research also looks at the general population and especially in nutritional research, it makes correlations that you can't really, like, as an individual, you can use research to guide you, but you can't draw like hard or fast conclusions based on what a scientific study says. Like, it all, there isn't really a way around it. It all kind of comes down to the individual experience. And so, like, number one is like your relationship with yourself, your own observations, your own awareness, your own body awareness. Number two is a practitioner working one-to-one with you that is looking at the nuance of your situation, right? And then number three is like, okay, now I can kind of take in more general advice, like group therapy, what works for most people, what might guide me if I'm feeling stuck, like this conversation, maybe you're getting ideas from this conversation, like maybe I need to loosen up on my weight training, maybe I need to go and see Nicole, or get some lymphatic, like focus on my lymphatic system, right? Like, but this is the difference, right? It's like, this is not health advice. These are just stories and ideas, and it actually starts at a more individual basic level, right? So in your case, it's like, you're like, everyone's talking about protein. There's a lot of reasons why you could get that. So like sulfate sensitivity, right? Like need is high in sulfur. Are you breaking it down? Were there other sulfates coming in that was overwhelming your system? Nitrogen. So it's like, it's not, it doesn't mean that protein or meat is bad. It doesn't, but it's like Goldilocks effects. And this happens all the time. And your individual history that might be different from the other person listening, who actually needs to be eating way more protein than they're eating. And so this is the thing. It's like, you can't. And so like, I think what Instagram does, what like these social media messages do, is supposed to like open up conversations and give us ideas. Like, oh, this is what a naturopath does. Oh, I didn't know a naturopath talked about like food. I didn't know a massage therapist helped you like lose fluid, and that weight gain could be fluid. But like you said, you're like, I'm not saying come to me for weight loss, because I actually don't know if that's your problem. But when I meet you and we work together, I'll get a sense of what your problem is, and your plan may have nothing to do with lymphatic drainage. Like likely it will. And so this is the thing. It's like we do we this is like top down information, but people have to understand that it comes like, it's the one-to-one that is how we work. You know?
The process of healing our bodies, or like, you know, building a relationship with our bodies to become better at like health and life force. It's so much more colorful than you'll ever imagine. And I'm saying this, that I feel like I'm only on the tip of the iceberg, you know, like, again, these are all ideas, but they're always changing, and they're always going to continue changing. And it comes down to getting to know the individual person, their colorful history, their experiences, their pains, their joys, their passions, like their struggles, like everything, all those things are included in trying to understand this process. And it is not limited to self-help advice on social media, podcasts, anything you see. Like, when it comes to these individual healing processes, like, you have to like do it one-on-one, or like with a team of people that is catered to your individual needs. Like, it's your unique plan, your web of healing. So that is really important disclaimer.
I feel like a lot of people can get advice, like can get great advice from the internet, and it will work for them, right? So it's like, I had one person I interviewed, and she was like, look, like, I don't know, let's say like somebody is talking about beef liver. Who was talking about that? I don't know. And you're like, oh, beef liver, maybe I should try it. And like, I got a direct message from someone, it's actually an old patient, being like, I want to tell you my experience taking beef liver. I saw your post, I bought beef liver, I'm taking it, and this, I know it's this and this. Great. Well, I didn't need to see her one-to-one. She got great results from it. It's working for her. And so sometimes, advice bestowed from on high could be really helpful, but there's more nuance to it, right? And so in your case, you came to me and you were like, look, I saw your post about protein, and I went to town on animal. I ate a bunch of animal and flesh, and I felt hungover. I'd be like, okay, let's talk about it. Like, do you like, specifically you, Nicole, maybe you don't need as much protein for whatever reasons. How are your detox pathways? What are your sulfur pathways? Like, how's your stomach acid? What, maybe it was just like a lot of protein. There's so much nuance, and like that we try to get to the bottom of. That's the one-to-one relationship. So I would say to people listening, like, if stuff doesn't make sense, or if you feel like it's counterintuitive, or you feel like there are special snowflakes out there. Like you could just not be, this just may not apply to you. And so, or there might be something else to address first or whatever it is. So then, yeah, book and work one-to-one. But I like personally, and I think you're probably like this too, is like I weave in and out of one-to-one. Like I'll hire a practitioner to work with closely. Then I'll sort of do my own thing. I'll give something a try. I'll look for ideas and inspiration. Like that's all fine. But I think having a conception of what's going on is important. And if you don't have that, then that's where the practitioner helps you, like to identify what it is that you're doing.
100%. With that saying, there is still like a really important process where the client needs to integrate all this stuff with their own wisdom, and that like sometimes constantly seeing somebody all the time or becoming dependent on your practitioners can actually be damaging and like after some time, right? So it just comes down again to your individual needs. Like if you need help, recognize you need help and then seek it out. But also you need to acknowledge or recognize when it's time to take space from this help so that you can hear yourself and experience that you've had. Right. So all these you know, like healers, it's like, we're here to help, but also like at some point you might phase out and, you know, like integrate all of that beautifully on your own, come back another time when it applies to you. It's acknowledging when that relationship has transformed or is coming to an end or something needs to change. So that's also really important. I have also found that too when in my journey of healing, meeting tons of different healers, finding certain things apply to me, and then eventually being like, I'm taking all this in, and now it's time to branch out to different people, different healers, or different ideas or like methods, and take that all in.
And healers evolve, right? We learn new things. And so that's also like you might, now they're kind of on a similar path, or maybe we've diverged paths. It's not a marriage. You don't like, so many times people are like, I'm sorry, I fell off the wagon. I'm like, it's fine. There's so many reasons for that. You could be feeling better. You may just not, something we did together might not have worked. And maybe you didn't know how to tell me. Maybe I wasn't giving you the space to tell me. I don't know, like we're humans, right? So sometimes we have tunnel vision at times, or sometimes like it's in our one-to-one session, maybe we don't give as much as we should. And so this is why, like, I think therapy, right? You see somebody like weekly. And so then there's more of a, like, you might get the practitioner with kind of like a low grade headache one day, and then they're way more present and something magical kind of happens in the session the next day. And so I say too, exactly. Like you're ultimately the sailor, right? And so sometimes you need to like buy a new sail. Sometimes you got to ask the, whatever it's called, the co-captain, I don't even know, and get them to help you. Maybe you need a guide. Maybe you need, to find a more experienced sailor to help you out, guide you for a bit. Maybe you need to consult a map. Maybe you need a break. And maybe you shouldn't be doing it on your own. Like maybe now you've been doing it on your own too long, and it's time to reach out or change course a bit. Like it's hard. This is the thing. It's all, how do you know? Like it's back to that question again, right? It's like, how does somebody know? It's more, you might not know, but the process of finding out is maybe where the healing occurs, right? It's like the asking of the question.
My whole thing is client autonomy. I want to work with you if you want to work with me. If you don't want to work with me for whatever reason, power to you. That is your choice. The magic happens with your decision to choose the healing process, because that's your ability to receive it, to receive the potential of healing. And I don't take this stuff personally. I'm not going to be for everyone, right? And I always like encourage, like every time I meet someone, a first session, I'm just like, they usually find me because they feel called to me. For the most part, it works out really well, right? But sometimes it won't be for somebody, and I'll explain how I approach people, the body, in healing, and that if any point anything is uncomfortable or you don't like it, just let me know. And then I will based on the assessment, the treatment, how they feel after, I'll encourage a treatment plan as like a baseline. Like, okay, so for example, for this issue, I always suggest like once a week for the first 6 weeks to retrain your fascia and your heal your nervous system. But it always depends on your needs. What are your needs? How do you feel about this plan? We can work with that. but you can also let me know what you think, or if you don't want to continue with this. So it's like power to them. Like at that point, they know whether they want to continue or not. Right. And so I try to encourage that autonomy for that person, like their own process of like, look, I'm here to help you. And if you feel like I can't help you, let me see if I can like refer you out to somebody else, because I want you to be the best person you can be in the ways that that means to you. Like there's no me in this. It's the client, right? So I always believe that. I always believe that strongly, and I support that for all my clients. If you don't feel aligned with me, I support that.
That's actually a very healthy stance to take as a healer, and good for the clients too, because it can be a very personal process and it can hurt your feelings, especially as a new practitioner. When like I have the experience of somebody not coming back, right? And a lot of the time they just feel better, right? So you just don't know. Or all the times I think that I haven't gone back to see someone, it didn't have anything, it was about me. It really didn't have anything to do with them. And and even like taking one piece, right? Like taking one piece that you carry with you. This is what we're talking about, where it's like the energy work, right? It's like sometimes somebody just says something that maybe the practitioner didn't even remember saying, and that you remember, and you don't. One of my friends, she goes, between therapy sessions, I need 6 months to integrate it. And the therapist may not see it like that. They might be like, no, you need to come every week because we have to work on this and this. But my friend is like, no, I take what you say, and then I masticate it slowly and metabolize it and integrate it, and I remember it, and it's changing me, and it takes 6 months. That's what my intuition tells me. And so it's, that's it. It's
so individual. That literally happened to me too with a therapist recently, where it's like finding a new therapist. I want to do week to week. And they're like, actually, I don't offer that. And I prefer more time between sessions so you can integrate it. And I'm like, this isn't for me.
Right. Yeah. You're like, I actually, I need something else. I need to see you. Same with like moving online. Like a lot of patients, like I want to see you in person, and I just don't offer that right now. And it's like, I get it though, or 100%. Do you have somebody that works with it? Like there's just, it's and our tools evolve, and sometimes our tools match the person, months ago when they went with someone else. Like one of my patients said recently, she's like, I really love how when my doctor would read something and think of me, they would reach out. And I was thinking about that. I'm like, because sometimes I'll be reading something, and a patient that maybe never came back because I maybe didn't have the tools at the time. I'm like, oh, this would be really helpful for them. And then I get in my head about, should I reach out and send this to them? What would they think of it? And so again, it's like, maybe they wouldn't like it. Maybe someone may love it. And so this is the art, I guess. It's where people were complicated, and healing is complicated. But I think and this is a very naturopathic philosophy, and I'm sure like as a holistic practitioner yourself, you probably agree with this, is like healing is happening. It's like a magnet, right? We are moving towards healing, and a lot of times it's just getting stuff out of the way. There isn't one right path. There's a flow, there's a life force that's trying to make it happen. And when I say healing, like you could have terminal cancer and heal, right? It doesn't mean like there's no end state of healing, but it's this organizational process of our body, and it's happening. So I don't know if you can make mistakes, we're all learning, it's happening.
Absolutely. It's one of those reasons why I truly believe that the people that are meant to be on my table, or people that I'm supposed to treat, they'll find me. I believe that. So, and it's like all about the flow state, right? It's like you're swimming along, and then someone's like, oh, hey, it's like, that is what makes the healing, is when the world collides so naturally, synchronistically, and beautifully. Like that is where the magic happens, not me forcing myself or trying to control a relationship or scenario. It's like I put myself out there, and if someone feels attracted to that, that's awesome. That means we vibe. That means we can work together, and that's great. But if it's not like that, then it probably won't be a good treatment. It probably won't be a good session or a good compatibility. But that's why I believe like that whole flow state of, supporting that person's healing journey.
Let it happen. That's why I love, and I don't want to be knocking on social media, because one thing I love about social media is it's a place where you can express your personality to send your signal out to attract people that vibe, because we do.
Yeah.
There is authenticity. Like your social media is very authentic. It really displays who you are, I think. And
Thank you. Yeah.
like your interests, and you educate. And so like I try and do the same thing, and it helps to create matches, because you're like, oh, I just something about that person vibes with me,
Yes.
whether it's the surfing.
What did someone, I followed this like social media witch. She's like, Instagram, your social media alter. And I'm like, I can't agree more with that. I can't agree more than that. You have the capacity to call in, magnetize an audience, what you are offering the world, what message you want out. That is the most incredible tool. And you can make that happen through social media and like your pictures and your sounds and your photos, how you present yourself. It's like an altar. It's like sacred exchange of energy if you choose that to be that way.
So cool. Yeah. So cool. Yeah. You can receive pings and inspiration, and like there's a lot, like, maybe that's the healing force taking place when you see a practitioner on there and you're like, something, I kind of want to follow this person. Maybe not, maybe I'm not ready to work with them yet. Maybe in 6 months, then all of a sudden you get this ping that you want to book an appointment. Like there's these things I think that happen that, that can be magical. Yeah.
Yes. Agreed.
Nicole, any last thoughts?
Thank you so much for having me on here.
You're welcome. I know it's like no pressure with like any last thoughts, just like throw out a general statement. No, this was so much fun. This was awesome. And where can people find you? So we're gonna have links to your Instagram and everything, but who are you on Instagram? Like, where do you work?
So my business name is called Embody Work. Given everything we're speaking about, that is the main goal for my clients and myself, because it's co-creative. So I'm on Instagram as Embody Work, EMBODI work. And my website is embodywork.com. So you just send me an email if you wanted to request an appointment with me. For the most part, I'm referral based, but I'm open to accepting new clients depending on their case history and their needs. So then you can chat with me on email, and then from there, I can send you a booking link.
Amazing. Yeah, so good. And you're, I think, in the Danforth, right? Or no, more like the beaches.
Yeah, I am in the upper beaches, Toronto. So I'm like Woodbine and Gerrard area. Some people are like, oh, it's so far. But I'm like, make it a beach day. Go get your massage and go to the beach. And so the modalities that I offer primarily are massage therapy, and under the scope of practice of that, I do fascial stretch therapy, which is assisted stretching on the table with your clothes on. It's all on my website, FAQ. You can see it all on Instagram, what it's all about. And then Reiki, and included in all of that stuff, I also do lymphatic massage. I love doing abdominal massages, breast massage. That was my specialty in school. Doing specialty breast massage workshops for scar tissue, trigger point therapy. The things that I do, that I focus on with people, it's very somatic, like a lot of somatic healing. So, and I use aromatherapies, essential oils, special body butters, custom by local artists, local craftsmen. I use crystals, not crystal therapy, but I do have crystals in my studio, plants and sage, candles, Palo Santo. So a lot of great vibes. So if this sounds aligned, you can email me.
Amazing. Thanks so much, Nicole. This is so great.
Thanks, Talia. Much love.